Hello everyone, I'm here with my good friend and colleague Dr. Steve Fihn from Seattle. Steve is the Director of Analytics and Business Intelligence for the Veterans Affairs Administration, and Steve is actually going to be a featured speaker at one of our plenary sessions at QCOR 2013. The title of the session is Electronic Health Records and Research. So Steve, tell us a little bit about what you do and what this plenary is going to be featuring.
It looks like a great panel, and I'm really excited to be part of it, and thank you for inviting me. What I'm going to talk about, I think, are sort of the transition we're going through from an electronic record, which was essentially a replica of a paper record, which is very good at storage and retrieval and some very simple tasks, that is really evolving into a much different animal, if you will, that is flexible, collects data from lots of sources, and I think over time will actually be a tool that we come to rely on for helping us make decisions on how to take better care of patients, in addition to just being a place where we store and document information.
Wow, that's fantastic. Can you maybe give us some tangible examples where that's been successful and some of the challenges as well?
Yeah, so it's evolving, and many institutions are really, I think, still tightly wedded to the more classic, if you will, electronic health record. But I think they're finding, for example, that they're just not going to be affordable. They're expensive, they require lots of hardware, they're tied to terminals, and they're not very flexible. Hard to keep up with the changing medical practice. In the VA, actually, we're designing a new record, which is a much different in terms of its format, which will be a fairly limited record, which has lots of, and this will be familiar, apps that will essentially, many of them can be open source, will essentially plug in to the sort of the basic vanilla record and allow us to do a variety of things. So an example would be, we've many years ago developed a program which manages our cath labs and allows us to do lots of things like not only track all the procedures and complications, but it supports our peer review, allows us to do device safety monitoring, now is doing asset management through RFID, and a whole host of other things such as radiation monitoring of operators, and our whole quality management suite. Well, that currently is hard-coded, runs on the systems at our medical centers, but we'll convert that over to a web-based application. So if you're a cardiologist, you pull that app down, and you can run it anywhere. You run it on your tablet or whatever device you're using, and you can think about literally an infinite number of those kinds of applications which could be tailored and run as part of I think a modern EHR.
Do you think potentially there's also an opportunity for a patient portal with these apps?
Well, absolutely. That's the whole, one of the big drivers here is that once you become platform independent, that any device really becomes has the capacity to contribute data. So patient portals for sure, but also devices. So devices in patients' homes, anything from a CPAP machine to motion sensors and all the kinds of data we will collect, all can now stream into what becomes the database underlying the electronic health record. And that's the other big piece of this is, again, we're going to have these gigantic databases that we can use both for research but also for patient care, which, in our current record, we really don't do much with the data as part of the process of care.
Right. No, that's really exciting. Can you talk a little bit more about sort of the opportunities for research and discovery and informing us what we should be doing or what we're not doing as well in?
Well, I think it's at this point limited only by my limited imagination. But I mean, obviously, I think there'll be the traditional sorts of health services and clinical epidemiology. You know, the opportunities for linkages and data mining and predictive analytics, I think, are huge. You know, I think that is really where, you know, the money's going to be. It's not actually going to be the operational IHER. It's going to be that data layer and how we use it to customize and personalize healthcare for patients.
Well, thank you, Steve. I'm really looking forward to this session because I think we have an army of attendees here who are creative and innovative and early career, and definitely looking forward to advancing the research using EHRs. Thank you very much.
Thanks, Henry.